Hello, everybody, and welcome. This is Dr. DeShavo. In addition to your welcome video, I wanted to make just a brief video about case studies. They're going to be completely new this year, and they are completely in your hands, and I want you to have fun and enjoy them and make a forum to talk. Here's the one thing I don't want you to do, is make it complicated. I want you to use these case studies to review material that applies to our weekly information, but don't make it complicated. So here is our brief discussion on the new way we're going to do these case studies. If you go into your discussion, you can read down and see the directions. I apologize, I was putting it on student preview, on how to do this, okay? So disease detectives, please read this carefully on how to create the case studies. You are all assigned to a week. I've automatically done this. You can go in and see your group, and I'll email your group the week it's due by going over to I'll have to post it. I apologize. I'll send you an email and tell you which week your case study is due. Once that week starts, I run my weeks Tuesday to Tuesday just because my Monday schedule is crazy. So your case study will open up Tuesday morning. You have until the following Tuesday, so an entire 7 days to complete the case studies. They'll be due by Tuesday night at midnight. Okay, so as I said, I'll tell you which groups you're in. If you're in group 1, it's week 1. If you're in group 2, it's week 2. If you're in group 3, it's week 3, etc. Okay, you're each during that week going to have to create a case study. You can create it any way you like. Please cover the basics because your fellow student will be trying to diagnose this patient. I gave you a list to help you in writing the case study. I always remembered it as doing a brief history with OPQRST. O, onset. P, palliative and provocative. Q, quality of the issue, etc. So if you have a patient who comes in with a sudden onset of right leg pain after lifting something heavy, you're going to ask them all these questions to help diagnose this problem. Okay, is there a time association with it? That's just how I've done my histories. I dealt mostly with pain though, so this worked pretty well. However you want to do it is fine. That's fine. Okay, once again, don't get crazy. This is just an easy thing I want you guys to do. Okay, so during the week that you're assigned to the group, you're going to create one case study and answer students' questions. This is going to give you 10 points. Just do it. It's an easy 10 points, okay? During the same week, you will ask questions in at least 2 discussions led by another student for their case study. But listen, you may only ask 3 questions, okay? Other people will be asking questions as well. After you think you have the answer, you may move into the next discussion section that you can diagnose or give your diagnostic guesses. I'll show you exactly how it's going to go. Okay? You will have 1 week to complete the discussions. Don't miss your week. I will email each group as to which week they have. That's it. Please don't make this complicated. Please keep it simple. Please keep it easy and fun. Okay? So, when your week is due, and I'll email group 1 now so you can be prepared, you'll come in and you'll see there'll be 2 discussions open. So week 1, group 1, you will click on it. You will create a thread. Okay? Your created thread will be your case study. Joe Schmo enters with, left-sided chest pain after a car accident, yada, 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 whatever it is, you'll put your name. If I could spell my name. Put your name, put case study, And then down below, post all information. Okay, submit. People will ask questions, respond to them, please. All right, and realize it may take people a day or so to do that. And that's it. Okay, after you go through and you think you have an idea, so you're answering the case studies, okay, you think you have an idea, you move into diagnosis only for week 1, okay, and put who you're guessing for too, okay, so you have to post first. This is why I'm doing this. So, sciatica, you know, you would put, or whatever, actually, put diagnosis for Meg DeShavo or whatever, sciatica, and then you'd post it, okay? Now, you won't be able to see other people's threads in the diagnosis, okay? Only after you post it. You'll be able to click on them and look if you're curious, okay? I'm really hoping this works, okay? If it doesn't, we're going to modify it, okay? I'm only going to post week 1 now. And people in week 1 can get started. And if you need a little extra time in week 1, that's fine, since we're going to be up and running a little bit late. Questions. Also make sure that you post your case study and answer or ask questions from other people as well. Now, if you get through with your case study and nobody guesses your diagnosis, guess what? You're going to get an extra credit point. So we want you to work a little bit hard on these case studies rather than just posting anything. Don't use old case studies. Don't copy other people's case studies, please. Pretty please. All right? Please keep this simple. Please keep it fun. All you need to do is post your case study and respond to 2 others, and you're good to go. All right? Don't make it complicated. Keep it simple. Thank you so much, and have some fun with it. These are really fun. People enjoy these. All right? Thank you so much. This is Dr. DeShavo. Let me know if you have any questions. Take care.